They are 100% human.
You're killing a human. If you stop it,
Which one is more important, the life of the mother or the life of the fetus?
Welcome to another episode of Messy Medicine. We are 4 board-certified physicians here to combat fake news by presenting you evidence-based medicine and knowledge. To my left, Dr. Ibikunle. To my immediate right, Dr. Jocelyn Slaughter. And to my far right, my boy, Dr. Nicholas Jones. And I am Dr. Marc Jean-Gilles. Welcome to another episode of Messy Medicine. We are 4 board-certified physicians here to combat fake news by presenting you evidence-based medicine and knowledge. This topic is probably going to ruffle some feathers. It is a very emotional topic, and given that it's an election season, you're going to hear a lot about this topic, and we are going to talk about abortion laws and IVF.
Okay.
All right, so let me ask all of y'all, why do you think when it comes to the topic of abortion, why is it such a trigger for people? Chris, I'll start with you. Matter of fact, no, ladies first. Jocelyn, because you are the lady in the house.
The only person that can
Have a
get
baby,
married,
yes.
not get married, have a baby or have an abortion. I'm the only one that can actually do it in here, but...
Tell me why it's such a emotional trigger. Why is it such a trigger? Why does it get everybody so mad?
It's very complex and it is very messy. It's very messy. I think that, we are designed, one of our big things as humans is we want to have babies, and that's a big desire of a lot of people, and it's the result of sex. And sometimes people get pregnant with or without trying, and many times people get pregnant. And one of the things that controls women a lot is pregnancy. And with medicine, pregnancy became something that you necessarily did not have to do. And women had some powers in that, where if I did not want to be pregnant, if I did not want to carry the baby, there was a way with medicine safely that I could not. So that was a way that women had some power and some control. And then it was not just if I just didn't want to be pregnant because I didn't like the guy, but it also had some health benefits where if I was sick and the pregnancy was making me sick, I did not have to die with this pregnancy. I could actually live, and I had a way to medically stop this pregnancy that would naturally kill me. Then there was also a way that if I had a preview of this pregnancy, I had a preview of this baby, and if this baby was extremely abnormal, and delivering this baby, it wouldn't impact my health, but it may impact my emotional health to deliver a baby that was abnormal. I had the choice of stopping this pregnancy. So and not going through the carrying a baby, feeling the baby, knowing this baby might pass away, or knowing that this baby could be a child that my children may have to take care of one day. It is a way that women had some more power and control that they used to not have. And it was a way that they could safely do it without doing it backdoor. So that's why it was a hot topic, and it's really a power that women had, and that men were trying to take the reins of, and women felt that this power was being taken away from them. Although it's power of choice, I just don't want to be pregnant by this man because I just don't want to. Power of, I want to have control of my body so I can safely get pregnant when I want to because I don't want to die of whatever. And then lastly, I don't want to carry this child because of whatever reason, my personal reasons. So now that's being taken away for multiple reasons.
I think, why is it a hot topic during election seasons? For lots of reasons. One, we all have our own moral and ethical beliefs. So you think about religion, and then just, like what you may consider life. And then when you think about politics, at the end of the day, you're trying to get votes. So who is your base? You're, right wing or left wing. Basically, you're trying to recruit your base. And a lot of times, this is a topic that comes into place. And then on the other hand, you think about women's rights, like women's rights and reproductive health. Like, you have this woman who's giving birth to a child, but then you have another constituent of people who say, okay, this fetus is also a human. They should have rights too. And so there's a clash, and I don't think there's a right or wrong. It just ultimately comes down to what you believe. And I personally, I feel like as a man, or if I was a politician, I don't think there should be a body of people who dictates what a woman can do with her body.
Okay.
I really want to understand more from you guys what abortion is, really. What is it?
There are two types, right? There's a spontaneous abortion. That's an abortion where, hey, we saw the heartbeat 1 second, but for whatever reason, mom's body just starts aborting on its own. It comes out. That's a spontaneous abortion. There are elective abortions, which are normal pregnancies. There's no issues. And if you just let the course play out, it would probably result in a healthy human individual. That's the one that's talked about the most, the elective abortions, able to terminate a fetus. And essentially, an elective abortion is a feticide, meaning you are killing a fetus. But to be clear, embryos, fetus, they are 100% human. So an abortion does effectively kill a human life. I'm not talking about personhood. I'm not talking about consciousness or whatever, or if they could feel pain or whatever. What we know is that once that, 99% of scientists agree, once sperm hits the egg, that's conception, life begins. End of story. All right? It is a distinct human life with its own genetic codes, all there, the height, the eye color, skin color, muscle tone, whatever. That's already programmed in that individual. And when an abortion is undertaken, it is killing a human life. It is a human being, 100% human being, just as at an early stage. Just like we were all babies this small at one point, we weren't as, intellectually evolved as we are now, but we were still very human, just at an earlier stage.
And I think one of the things that
So that's what an abortion is.
But I think one of the things that we have to remember as doctors is that language is everything. And I think the way we say things means a lot. So when we say kill, there's lots of different ways to say kill, end, stop, terminate, lots of different things. And so when you say murder, homicide, it's different things that we can say. So some people feel when you say kill, that means something that has a heartbeat. That's more of a kill. It was something that was heartbeating, that it's a kill. But then it could mean you can make something stop growing. Sometimes we say we stop the growth of it. So I think that as we describe the abortion, the ending of life, the ending of progression of the development of a human, that is how you say it. Some people, if you hear you're killing a life, that may be how you describe it, but some people say, I don't like the word kill. I like the word, I'm ending the progression of the development of this human life. Because, and that sometimes is literally the words, the just nuances of words that make people feel different ways. Does killing sound worse than ending or not allowing to progress?
I think killing sounds a lot worse.
It does sound worse.
If you tell me as a woman, you killed a human life. Versus if you tell me as a woman, you stopped the progression of your pregnancy. That is a different thing that as a person that did it, you feel differently.
That's semantics,
Sure,
though.
that's
But
It's not semantics.
but
It's
that's
it's
the sensitivity. That's sensitivity.
I wouldn't
that's
talk to a patient like that, but
I
I'm saying
understand
I'm
that.
defining what it is.
I understand
It is
what
what
you're
it
saying.
is.
You are mansplaining.
No.
I'm not mansplaining. That's what it is.
I understand what you're saying. Basically, you're saying abortion is termination of life.
Yes, but he said killing, and I just
I use
feel like using.
feticide.
But,
you
but
said
still,
killing. You said killing.
The life is over. But my question to you is, I think part of the reason why it's so complicated is some people may not feel like when it's an embryo that's a child or a fetus. I mean, they don't have they don't have a heartbeat as soon as conception.
No.
Nobody's okay. So again,
That's
nobody
why this gets
is
so messy.
nobody is debating about when the heartbeat, or I'm not even saying the heartbeat defines that it's a human life. Like
Get past this
embryos,
topic.
embryos in an IVF clinic, they're considered human beings. We will show our audience on the screen what an abortion truly is, like an elective abortion. And we will show our audience, you can stay here if you want.
Yeah, because
I
I'm
got
a
you.
woman and I'm an OB-GYN.
Yeah.
Y'all go learn something.
All right, come on, fellas.
Go
I'm gonna
teach
show you what it is. All right. Here we are at the screen. Jocelyn, this is what I'm gonna do. I'm gonna show these two men, I'm gonna mansplain to a man what happens during abortion. So, let's just show what an ultrasound is at 9 weeks. As you can see, at 9 weeks, you can see this. That's a heartbeat. Pause it for a second. This is the head. This is the buttocks, and these are the limbs. And this is a leg right here. Now, I am looking at this, and I want to ask you gentlemen a question. Is this a human life?
It looks human.
I mean, there's a heartbeat.
Is it a dog or is it a human?
Oh, wow.
I'm
Yeah,
just saying, it's a human life.
human.
Okay.
Yeah, absolutely.
So I'm not trying to be harsh or anything like that. I'm just saying two humans made this creature. It's a human life. It's just simple science. It doesn't take a genius to figure that out. So what happens with an abortion? An elective abortion, right? Like this, let's just assume this pregnancy is totally normal. If it continues on, it's gonna be a normal baby. Well, what happens is you do liposuction, right?
Correct.
And what do you use to suction out the
A
fat?
cannula.
A cannula, right? And it connects to a container,
A vacuum, yes.
a vacuum that suctions out the fat. Well, that actually came from OB-GYNs, and we have that. And what would end up happening is just imagine a cannula goes in here, and all this suction takes place, and gone
Right.
out.
I'm assuming the cannula is probably a much larger diameter. At 14 weeks, or how
This
how
would
many-
be a 10, size 10 cannula.
Oh, wow, that's huge.
Right. Yeah, you would never use
The
that.
largest I use about 4 to 5 millimeters.
Right.
Yeah.
So a size 10 cannula would be as thick as my thumb for those who can't see. So we dilate the uterus, you suction
Right.
it out, and this is at 9 weeks.
So at 9 weeks, what size is a fetus?
We're talking about maybe this big.
Okay.
Now,
Okay.
is the abortion done under ultrasound guidance or not?
Yes, okay. Depending on what state you're in, you're not going to get this done at a hospital, and it's not going to be covered by insurance. Okay, it's usually done in clinics under local anesthesia, and most patients pay. Now, it is done under ultrasound guidance, just to see like everything comes out. Right? That's the intent. I've seen some botched ones where products were still left in, and so forth, and patients were still bleeding. But whatever the case is, you have this. We're gonna look at it one more time. It's here 1 minute, and if you were to do an abortion, it suctions everything out, and that's the end of that. That is what an elective abortion is.
So I'm assuming the ultrasound is done to make sure you get the entire fetus.
For those providers who do that, yes, they do the ultrasound because one, you don't want to perf the uterus either. There's always a risk that you stick the cannula up too hard, you can perforate the uterus, cause severe pain, bleeding. So it guides you not to go past this point.
Right.
But yes, also you can see that everything comes out. But that's what an elective abortion entails, and it's just there's no way to clean it up. That's just what it is. This active human being no longer exists after the procedure. So you want to call it ending, stopping progression, fine. But we know what the results are. So that's what it is, and that's what we want the audience to know, because I've talked to a lot of people, and when I showed them this, they never realized, oh my God, I didn't realize that, it looks like a baby at 9 weeks. And I'm not saying I'm discussing abortion. I'm just saying I've had new parents come in, oh my God, when I saw it at 6 weeks, it was just a flicker. Now it looks like a little human being. So it's just people don't understand what takes place, what it looks like, and what it really is. But this is what it is. I mean, you could see the head, you could see the butt. The next ultrasound we're looking at is at 14 weeks. you can clearly see a nose. You can see the brain developing, the spine, and you can even see fingers and toes at this stage. And look at this baby's moving. Mommy won't feel it at 14 weeks, but again, I would ask our audience watching this is a human being, and it's very much alive. Now, at 14 weeks, for those who want to get an abortion, that procedure is a little bit more entailed. You just can't, it's a bigger baby and has more bones to it. This may sound graphic. You can't just use the regular suction and get everything out. Sometimes there needs to be some destruction, meaning you clamp down, break some bones. You crush it, break it, make it easier to come out. There's another way to be done. Like you could just always induce the patient, give them medications, put in some dilators, and get them to deliver it vaginally. That can take a day or two before it all comes out.
That's done in a clinic too?
No, it's not like you can stay overnight in a clinic. But I mean, I've heard of some places where they'll give you the medication to take at home and try and get you to miscarry at home. And if you bleed or whatever, which happens often, if it becomes too excessive, then go to the ER. And that has happened as well. This is at 14 weeks. And the reason why I bring up 14 weeks is because the proposal is a federal ban on abortion after 15 weeks. At 15 weeks, I mean, it pretty much looks the same, it's just bigger. But it's just a illustration of what it is. I just want our audience to see it. I'm not trying to shock anybody. I'm just here saying, if you have a question about what abortion entails, this is what it is. So let's go back and finish up our discussion with Jocelyn.
Okay.
So as you saw there was a heartbeat. You introduced the suction cannula in, and it's no longer there, right? And then for the 14-weeker, you can see limbs, you can see legs, you can see a nose profile, you can see the heart, the organs,
Why are you trying to scare them? Were y'all scared?
Yes.
Was it okay? Well, so
I mean,
yes,
is that?
It's impactful. It definitely
Okay.
was impactful.
it's impactful, but I think that there's two, especially for physicians and as women. I think the society is focused on, and especially the politicians are more so focused on this elective. I have a super normal pregnancy and I want to terminate my pregnancy just because I don't feel like being pregnant and I don't like the person I had sex with. But then there's another portion of women who are trying to terminate their pregnancies because this is either an abnormal pregnancy, so abnormal that they do not want to go through the trauma of having this baby. And medically, we have been able to help women not go through that trauma. Before, you had no choice. You might push out a baby that was so abnormal that it might mentally mess you up for the rest of your life, or it could be very abnormal. But also, there's this one caveat that we talk about a lot of women who break their water prior to about 20 weeks, prior to 21 weeks.
We're gonna get to that.
We'll get to that.
Yeah.
But those are the people that I think that when you're showing this, you're showing it to, I feel like it's some shock value going on here. I feel like you showing this video, this thing was being a little messy.
For that, I'm totally fine with abortions. I'm not stubborn. I'm not obstinate. I understand that, look, if a baby is anencephalic, which means they have no brain, they can be born alive. They're going to live for a few minutes, hours. They're eventually going to die. I don't see the need to put a mother through that. There's exception for rape, exceptions for incest, exceptions for if the mother's life is in danger, and fetal anomalies. Okay, that's the state law in Georgia. In Texas, they don't clarify rape or incest, and they didn't make it. They don't clearly write that it's a issue for lethal anomalies, but they do state that if the physician determines that the mother's life is in danger, an abortion can be undertaken.
Let me explain why this can get very messy and why giving a woman free will to have free choice is important. So why, when you start having all these restrictions, it has to be for rape. That means the person has to actually go and report the rape, okay? That is messy. You gotta go report the rape and tell everybody this man raped you. Number two, why this whole fetal anomaly thing is messy, because it's which fetal anomaly. So right now, there are many places that do not consider certain anomalies as life-threatening or able to be terminated. When you start making all of these criteria for who and when and what, Now everybody has to explain why they should be able to have a termination. You got, oh, excuse me, this is the reason why I should be able to have one because I was raped. And then now the woman has to give all this information and all these reasons for why she has to. That is my issue, is that once you start saying you can for these reasons, now these women have to give all their business out on the street to why they should be able to have one. And before, when people were able to have the decision with them, their doctor, and their partner, that's why it was private.
Let me ask you this, right? Forget the anomalies, forget rape or incest. Let's just say she's now mad at the man that got her pregnant and no longer wants this baby.
And she's 30 weeks pregnant.
Well, we can't do 30 weeks. It has to be less than, it can't be viable.
I know, but what I'm saying is, like, you brought this point up, but
we do have some limitations.
I know.
There are some limitations.
Right, but what I'm saying is, as long as there's limitations, there are always going to be some outliers.
So if
And there are women, I respect, women you should have rights, you should be able to make some choices, but I still think it has to be within reason.
It was, and we used to have that. No, there was
Like,
reason.
do you think it's fair to say, all right, I'm pregnant by so-and-so, and you pissed off at him and you say, you know what, I don't want to have this baby now.
And you could not do it up until 23 weeks,
But
24
even
weeks.
still, is that the point? Is this? It's still a human. Is it a human life, Jocelyn? Yes or no?
We've already said that it's a human life,
so
and that is
it-
her personal decision
So
in private.
my question to you then is, does that human life have any value or any less value just because it's in your uterus? If we're doing it for personal lifestyle reasons, not medical reasons, not rape or incest, but like, you know what? I just can't take care of a baby right now. I can't afford it. What is the difference for those who want to allow abortion all the way up until term?
Nobody wants to allow abortion up until term.
Okay,
Nobody wants to do that.
What is
These
the
are
difference?
extreme.
What is okay? So fine, 12 weeks.
The termination of pregnancy had to do with the power of women. Before, but is that if a woman got pregnant and she did not want to keep the pregnancy for whatever reasons there were, that these reasons ranged from this pregnancy could kill me. It ranged from this pregnancy is genetically abnormal. This pregnancy ranged from I was raped to this pregnancy is whatever. That woman had the ability to terminate that pregnancy. Now, the Supreme Court, when they first did the Roe v. Wade, what they cited was privacy, is that, and I think they got it right, because they were like, before we decide why you want to do this, can you give us all these reasons, it was going to create this Pandora's box. That in order to get an abortion, you had to, you can't do it for this, and you can't do it for that, and you can't do it for this. And that was, I think they foresaw this whole discussion. I think they foresaw it all. And they said, we're gonna have a few parameters where you can't get an abortion if you're past, even if this baby is genetically abnormal, that you can't just terminate some Down syndrome baby at 30 weeks. But they were like, because getting all this information up front from a woman about why was violating her privacy rights. And that's what they said. And this is violating the privacy.
And maybe
Don't ask me why.
Too, because previous
Don't
episode,
ask me why. I'm doing it. Leave me the hell alone.
Yeah, we talked about
Now, mind you, I don't do
force a
abortions.
C-section.
Okay, don't come by my office. I don't do them. I ain't had one before. Leave me alone. But what I'm saying is that I think that when men and people, I think as a society, and I think it's all about society. As a society back in the 70s, this is what we said. If as a society, the lawmakers come out and the society votes against it, then that's what the society votes for. We're a democratic society, and if the majority votes that, then I will abide by the majority's rule.
Jocelyn, I'm gonna ask you, you mentioned something about a 21-weeker being ruptured. Have you ever had to do an abortion to save a mother's life?
Absolutely. So if, our first patient is mom, and if we believe that mom's life is in danger, we may have to separate her and the pregnancy. And if the pregnancy is not viable yet, and that means that by separating her and the pregnancy, that the pregnancy dies and the pregnancy passes away, then that's what we have to do. We try our best to keep the pregnancy in as long as possible so the pregnancy can survive. But if we can't, our goal is to mom. And so this situation where somebody's water has broken, we try to if we know that the pregnancy can't survive very long at all, we try to separate them before it becomes a danger to mom. Why wait till there's a danger to mom? But now with these new laws, we're having to wait until there is a danger to mom before separating them if the pregnancy is still alive. And that has been a problem.
Are there situations where you may not know if the pregnancy can continue on? You're saying your responsibility is to mom, but what if that fetus can survive?
So this is where it gets
How do
messy.
you-
This
how do
is
you- how do you-
perfect.
how do you
This is
determine-
perfect.
How do you determine whose life
Right.
takes
So-
a priority?
First of all, you have to counsel the patients, right? So what she was explaining is, let's say you have a patient who's 20 weeks pregnant, but unfortunately her water breaks. We do the ultrasound, there's no fluid around the baby. Now, her being ruptured, okay, there's a couple of issues. One, there's no fluid around the baby. So the uterus collapses on the baby. So the baby can't grow properly. The lungs can't develop properly. Two, there's a rupture, and now there's an avenue for an infection to crawl up in the uterus and not only make baby sick, but also make mom very sick. And so all we can do as physicians is we'll get the neonatologist to come talk to the mom about the prognosis. We'll talk to them about the risks and so forth. I've had patients break their water at 20 weeks and they want to wait. And, all of them delivered either earlier or got very sick, got an infection. But that's their prerogative. They understood the risk, they took it, and I'm happy to abide by it.
When it comes to this topic, there will never be
There will
black and
never
white
be.
because there are always exceptions. And so I think it'll always be something to debate about. All right, let's say 12 weeks, woman can have an
Yeah.
abortion regardless of the case, but there's still gonna always be exceptions. So
It will.
this is gonna always be great. I don't think
I would
there's
say-
a right answer.
I would say that the heart of this topic is it always gets framed that it's about men controlling women's body, but the reality is that there is just as many women who are pro-life, and it's
Absolutely.
because they look at it and say that human life has value. And I'm not here to argue whether you value it or not. I'm just
Right.
here to tell you what it is, what it involves, and we're here to discuss these laws. So we discussed the laws, we talked about exceptions and so forth. So the last topic I want to talk about, I'm going to ask you this. There was a case in Alabama with in vitro fertilization clinic where the Supreme Court of Alabama said that embryos are humans. Now, the media and others turned it into, again, controlling a woman's body. Is this what the case was about? Chris, what do you think? Real or fake?
Well, I think it is a real issue, and I think it's not just a simple issue of defining embryo as human being. I think it was more of actually making IVF therapy illegal. That, to me, well, I don't know, correct me if I'm wrong, what I read was Alabama said IVF is illegal.
So you think
So,
it's real? Go ahead.
I think it's real. I absolutely think it's real.
Put that up.
Yeah.
Nick, again, is the case in Alabama where the Supreme Court decided that and ruled that embryos are human beings? Is it about controlling women's body?
Well, to an extent it is, because really it all kind of ties back to abortion. So if you're gonna say that that embryo is a human, then it all kind of ties in with the whole
Okay.
reproductive.
So what do you think, real or fake?
I think it's real.
So put up the sign.
Give me the sign.
It's a sign. My last time for today, I'm gonna say it's messy. I think that Alabama is definitely in the Bible Belt, and I think that when you do a lot of IVF and you get to have sometimes designer babies, and they people who are in this area they hear about all the things that are going on with pre-genetic termination, and they're hearing about, oh, they're discarding all these embryos. They get to put this one in, and they don't want a boy. They can get the girl away, and they have all these leftover embryos that they don't like it.
There was a couple, and first of all, just keep in mind, in vitro fertilization is expensive. It's usually a couple that's either putting their money together with a desire of getting pregnant. These are people who want to get pregnant and can't. And what happened was there was a couple, they went to a clinic and they got pregnant. But as customary, when you deal with these clinics, they get a bunch of embryos, right? So it's more than one. And the ones they don't use, they store it. And they need to be stored in a special manner, sub-zero temperatures and so forth.
Right.
So somebody at the clinic was transporting whatever, mishandled the embryos and dropped them. I think the story is he touched the embryos, which were sub-zero temperature, burnt his hand, dropped them, and destroyed their embryos. So the couple sued, right?
Right.
Now, the initial court said they're not human beings. It doesn't apply as far as wrongful death goes. They then brought it to the state Supreme Court. And the Supreme Court said, no, they are human beings. They ruled on it. So now this couple can go pursue the lawsuit for,
Right.
human, wrongful death, right? And so that's how this suit started. I don't think it's about controlling a woman's body because, again, embryos are stored, they're outside, and people who go to these clinics typically want to get pregnant. So again, it's
But it does bring up the topic of what do you consider as a human in his life? Like the comment you made, these designer babies. Like, I'm not a woman, but I mean, I could see, people could easily be offended by things like that. Like when you said kill a baby.
Yeah, I know.
mean,
I
that's-
do that
I
on
think that was
purpose because
just
I
as-
was trying to.
To me,
I
that
was
was
trying to
just
get
as
her.
bad.
Right. Well, I mean, what people.
That
but,
was just as bad to
well,
me.
Yeah.
But that
I did.
people
That
can
was
get
insensitive.
offended. Well, I think when I say designer babies, I mean that when you are doing in vitro and when you're having IVF, you sometimes have the choice of the type of baby
But
that
shouldn't
you
they
want to
have a
get.
choice just like you should have a choice whether or not you want an abortion?
When you say who should have a choice, who are you talking about?
That couple.
That they
So the
should be
man
able
and the
to
couple?
decide
The
that,
couple,
that,
they're
that they should be able to
deciding together.
decide what type of baby that they want in. That they should be able to decide that, okay, no, that baby has different genetics. I want to put this baby in.
I don't think we're there yet with technology.
Well, I mean, sometimes it could be, well, I want
I
two
mean,
girls.
they
I
can
don't
decide
want any
whether or not
boys.
they want a
I
boy
want,
or a girl.
I mean, like that could
Some
be.
people want twins, some people want triplets. I mean,
Well, we try not to do triplets though. But I mean, but it can't. I think that as we are getting so powerful as doctors, we're getting extremely powerful.
I don't think so,
Technology.
The
but
technology
It's
and,
technology,
and we
okay.
right and our technology, and we do have to reel ourselves in a little bit as we're learning, especially in OB-GYN and reproductive medicine.
I just want to say this. It is a complex topic. I do feel like there is a lot of misinformation out there to try and not make abortions seem so bad. 95% of abortions are done electively with no risk to the mom, no fetal lethal anomalies, no rape, no incest, right? These are just, hey, I was having sex, I wasn't ready to get pregnant. And I think that we have to ask ourselves, is it a human life and is there a better way? I don't think women should be criminalized, all right? And I would definitely say that there should be laws put in place to make men more accountable. I do think it's unfair that it all falls on the woman. I think there should be like some serious penalties for men for impregnating a woman or abandoning your duties as a father. I'm totally for that. What I'll stand on is this. An embryo is a human life. That's 99% of the scientific community will say that. There's people who are pro-abortion and will say, yeah, it is a human life. It has no value in the uterus. If that's the case, then just say so. But you'll find, what I find in the public discourse, right, is that those who support it, they don't want those words to come out. They want to say, don't say kill, don't say murder, they don't want to call it what it is. But just say, if you support it, just say then, hey, I don't support the value of a human life inside the uterus.
As a citizen, as a physician, I'm going to follow the law, the letter of the law to the T. That's my story.
I agree with Chris. Like, follow the law, but I really do think it should be standardized throughout all the states.
So what are you for? A national ban to a certain, what would you, so
I-
That's not a fair question.
no,
Yeah,
but
that's
I'm
not
saying
a
if it's
fair-
standardized, that means it's
I
standardized.
feel like it should be, everybody should have the same options. Whether
Okay.
it's like, okay, you can have an abortion up to 12 weeks, whatever it is, it needs to be standardized so that if a woman is in this place, she has the same options whether she's in California or in Florida.
So would you be fine with a federal ban as proposed by Republican candidates like Donald Trump? For
No.
like the proposal is up to 15 weeks, and that's it federally, all throughout the United States. You're fine with that?
If it's standardized and that's what the if that's what the people vote, and a majority of the people feel that way, I would accept it. Yeah. I mean, I'm not saying that it's completely right, but I think it would help out with these sticky situations.
I would like to go back to reenact the original Supreme Court Roe versus Wade. That's what I would like to do. But I will follow the letter of the law. Again, I don't perform abortions, but I try to help my patients get whatever that they need with it, which is legal in the United States of America, and which is evidence-based.
Gotcha. And I think no matter where you stand on it, there shouldn't be like this hostility. We're just engaging, having fun with
We're
it.
still friends.
But I know people are going to get agitated about this topic. With that said, we'll just see what happens this election. We'll see where it goes. We hope today's topic was informative. We hope that you were educated. And if you have comments, I mean, we would welcome them. You can troll us. You can agree with us. Bring it on. We love it. We love dialogue. That's what we're here for, to educate and inform. And that's it. That's it for our show. Till next time.